So last summer, the FDA released their new guidelines in terms of how sunscreens must both be evaluated as well as how they can be marketed. First and foremost, UVA. Ultraviolet A radiation is not typically the one that burns. I consider it the silent killer, as you may not know you're getting exposed, but it still incurs the same damage that can result in accelerated skin aging, dark spots, and of course, skin cancer. Before last summer, no one really ever approached how to evaluate how these materials that block UVA are really effective or not. The FDA has now drafted guidelines by how companies must evaluate these products in order for them to actually say broad spectrum on the label. The next component of the guidelines was saying whether something could be sun protective and protect against skin cancer or not. And this was determined by the number of SPF. Anything below SPF 10 really is considered not sun protective and can really go on to protect against skin cancer. They say SPF 15 can block about 94% of ultraviolet B radiation. However, the American Academy of Dermatology recommends that everyone use at least SPF of 30 or higher. Another part of the guidelines refers to if a sunscreen be called waterproof, and in fact it cannot. Sunscreens can only say whether they are water resistant, and this refers to a sunscreen being able to be applied and stay effective for up to 40 minutes in water. Therefore, no matter what sunscreen you use, if you're in the water for more than 40 minutes, you need to get out and reapply. In terms of how nanomaterials are used, these are of course materials on the size range between 1 and 100 nanometers. The FDA hasn't really approached this yet. In terms of what's out there in the literature, everything suggests that these materials do not penetrate the skin and cannot cause any problems. However, there's been a great deal of controversy because when you put these materials with cells in the lab, there's a very different story. These studies, of course, underestimate the complexity of the human body to really compensate for these materials and appropriately get rid of them and not allow for any harm.